Morning. Welcome to Talks with Anthony. Today we're going to have a insightful conversation. For those that are new to the channel, we make mental health conversations and content that's going to be beneficial to your personal development in addition to your well-being. However, in today's conversation, we're going to be talking about sociopathy and psychopathy, understanding conditions marked by limited empathy, right? So I want to take into consideration that not all mental health conditions look the same, and understanding differences in emotional processing can help reduce fear and misinformation, right? So off rip with the research, sociopathy and psychopathy are often discussed within the same frameworks as antisocial personality traits, involving differences in empathy, emotional regulation, and behavior, according to the APA. In addition, accurate education supports informed responses, healthier boundaries, and reduced stigma from the National Institute of Mental Health, right? So stick with me, grow with me. We're going to be able to navigate throughout this video, right? Well, I really want to be able to offer some strategies for navigating interaction safely and effectively for those out there that are experiencing limited empathy, right? And processing in that sense. However, first segment we're going to dive right into is what are sociopathy and psychopathy, right? So once again, it is that connection of the antisocial personality traits, right? So both sociopathy and psychopathy fall under the antisocial personality disorder, ASPD classification, though they may present differently, right? So they have their differences, don't get it twisted. However, they're in the same bucket in that sense, right? So it also is tied to empathy differences, right? So individuals may have limited emotional empathy, particularly affective empathy, while sometimes retaining cognitive empathy, according to the National Institute of Mental Health. But moving forward, behavioral patterns, let's dive into some of the traits. May include impulsivity, manipulation, rule breaking, or difficulty reforming emotional reciprocal relationships, right? So you may wonder why is that I treat this person good and I'm loving and I'm helping them out and I'm so supportive, but they're not reciprocating that, right? So this may be that issue, right? So in that sense, based off of those behavioral patterns of that individual not being able to understand their emotions of other people in that sense. But moving forward, developmental and biological factors, right? So we have genetics, we have brain structure differences, we also have early life experiences that may contribute, according to the CDC. So everybody's situation is going to be different, but in that sense, there are traits, emotional differences, like I said, within the classification, behavioral patterns, and then obviously biological factors that cause differences based off the individual's developmental stages of their life. But moving forward, in regards to our next segment, we're going to talk about how these traits affect relationships, right? So how is this difficult for those people to interact and engage with other people, right? So emotional disconnect, right? So difficulty recognizing or responding to others' emotions can strain relationships, right? So there's a difficult in that stance there, right? Trust and boundaries, right? So manipulative or inconsistent behaviors may erode trust over time, right? We have conflict patterns, right? So relationships may involve power struggles, lack of accountability, or emotional harm. So are these individuals recognizing what's going on, what their impact is, what are they doing, right? And how they're impacting other people in these relationships of, those interactions. We also have impact on others, right? So partners, we have family members, we also have coworkers may experience confusion, stress, or emotional exhaustion, according to the CDC as well. Moving forward to our next segment, let's talk about those mental health considerations, right? So not all individuals are violent, so don't get it twisted, right? Just because someone doesn't have empathy doesn't mean that they're a bad person or they're violent, right? Don't get it twisted, right? Keep in mind, like, an understanding mindset, as research is showing that most people with antisocial traits are not violent, though some may engage in harmful behaviors, right? So it's not all of people, right? But it is some. Let's not get it twisted, according to the APA. We also have co-occurring conditions, right? So substance use disorders, anxiety, or depressive, depression may also be present for some of these individuals, right? So that's what I'm saying. It's not good for us to sit there and judge them, talk down, they're a bad person, et cetera, using these negative words or the self-sabotaging behaviors, but really understanding that there are symptoms such as someone being anxious or being depressive that tie into what their current condition is. We also want to take consideration of treatment challenges, right? So limited insights or motivations can make it difficult for one to be able to navigate treatment. So we got to be able to take that, like I said, in consideration of one's mental health considerations. Next is going to be risk awareness, right? So certain traits may increase the risk, right, of harm of interpersonal behaviors. This also is tied to underscoring the importance of boundaries, right? So that's what I'm saying. One has to be able to be intuitive, know what the do's and don'ts, know how you feel. You know what I mean? Like have that insight in regards to yourself, so you're able to prevent that harm in that sense, right? In those behaviors as well. Next segment, let's dive into navigating interactions safely and effectively, right? So off rip, we got to be able to, like I said, incorporate setting boundaries, right? So consistent, limits help protect emotional well-being, right? You got to put yourself first. No one knows what you got going on, what you're going through, right? And by having some intuitive insight in regards to yourself and setting those boundaries will help you out long term. Addition to that as well is avoid emotional reasoning, right? So logical, direct communication is often more effective than emotional appeals, right? So it's not about looking at someone trying to read through their mind, read their body language to the best of your capabilities, but just use what we all got, right? That mouthpiece, right? So communicate with somebody, right? More effectively. Use being respectful. Don't get twisted, right? Is going to be able to help avoid emotional reasoning. Addition to that as well, we have do not personalize that behavior, right? So only you know what you got going on, and focus on yourself, but in that sense, but understand these behaviors stem from emotional processing differences can reduce self-blaming, right? So be compassionate, love yourself, understand that you're not the only one that's going through this, right? And there is a way to navigate through this on a supportive note, right? So have understanding and seek the support as needed. Next is going to be seek professional guidance. We just talked about that, you heard, but therapists, counselors, and people out there that are proactively trained and have the skills to help you as an individual develop those coping skills and those safe strategies, right? So utilize those professionals for that guidance. In addition to that as well is prioritize that safety, right? So you are a priority, right? We got to be doing things proactively, positively, safely, right? So in case of, that manipulation, abuse, or harm, right? Distance and that support are essential, right? So there's people out there to help us out when it comes to any of these situations. And I don't want you to be tore from the floor up. I don't want you abusing yourself. I don't want you to be in harm. I don't want you to be in a situation where you're being manipulated, et cetera, et cetera. So seek those proactive help and that support safely. Prioritize yourself. You are important. Right. Next segment, let's talk about that support for individuals and those around them, right? So, and it may not just be you. You may want to be able to have some understanding about how to go about this, or as I'm interfering with people that may have this, et cetera, but stick with me, right? So off rip, we have mental health care, right? So some individuals benefit from structured therapy, focus on behavior management. So, right. So if this could be for yourself or those out there as well for that support, but we have mental health care. We also have support for loved ones, right? So like I said, the counseling and support groups to be able to help affected individuals process those experiences, right? So groups are nice because you have other individuals that have a similar situation that you may be going through as well. And by you guys having that peer support and being vulnerable, being open, and having these live discussions are going to be able to help you and even enlighten other people that's listening to be able to talk about their experience, so things can really be able to be moving in that room, right? So that's why it's good to have those safe spaces where you're able to freely talk about whatever's going on, and you're able to have those connections with other individuals. Or if you don't feel like you're ready for that, have that individualized conversation with the proactive therapist to help you facilitate those coping skills and that treatment for yourself. Next, let's dive right into education and that awareness. It's very important to have an understanding in regards to traits on reducing the confusion and the emotional harm that is tied to supporting these individuals. Next is that community resources. We have legal, workplace, and mental health resources to be able to help the necessary and high conflict situations, right? So we need to be able to have resources to be able to help us in this population as well, for those out there that need this type of support or encouragement as well, right? So coming to a close, right? So we really want to be able to take into consideration that knowledge is protection and that empowerment, right? So if we don't know, things ain't gonna be proactive. But if we're seeking the help, we're advocating, we're seeking the resources, we're getting around people, we're being a little bit more vulnerable, we're confronting what's going on, how we feel, right? We're gonna be able to move somewhere, right? So understanding complex mental health conditions allows us to respond with clarity, compassion, in addition to our having healthier boundaries, right? So when it comes to some supportive research, education, boundary setting, and professional support improve outcomes for individuals affected by antisocial traits and those who interact with them, right? So I really want to take into consideration, you may not be the only one that's going through this, right? There can be some other people that that may be going through this, right? But having that understanding, seeking the knowledge, and proactively doing things to support you is going to be able to help you, rather than just kind of just keeping it pushing, just kind of self-isolating yourself, right? So awareness powers individuals as ourselves, right? To be able to protect our well-being, rather than just reducing or just having that misinformation and following the stigma and just kind of, like I said, suppressing these emotions and these behaviors, right? So proactively seek that support. There's therapists out there, there's people out there, people want to see you win. For the organizations out there, you know what I mean? Like, get right, support y'all people, support, you know what I mean? Like, getting some type of understanding and putting the mental health for our nation, for our minds, and us as individuals as a priority first, right? So if you found this video was beneficial, give it a thumbs up, share if possible, and I'll see you on the next one. Stay blessed, take it easy.